beyond political rhetorics, I'd like you to kindly share with us the primary objectives and detailed components of this particular insurance scheme, and how is it expected to transform South Africa's health landscape, and of course the economic impacts that might likely come as a result of optimizing this particular sector.
Thanks very much for having me, my brother, and I'm hoping the viewers are also having a good time. The national health insurance discussion started during the tenure of the former president, Jacob Zuma. Even though in 1994, about 30 years ago, the then Minister of Health, Dr. Nkosazana Dlamini Zuma, had mentioned the fact that there needs to be a reformation, a restructuring of the South African health industry, health services, and health provision. However, at the time, it was not in favor because the government then thought it would just complicate things and there might not have been enough budgeting available for it to be sustained. Guess what? 30 years later, there's still people who believe that the budget is not there. And truly and honestly, I think there is no budget for it. It's just been put there because it's part of the ruling party's ways of promising or delivering on the promises that were made in the past. So what is so difficult about national health insurance is because the bill itself does not go into detail enough to explain how it will benefit South Africans. And also what seems to be left out is how the current private sector will be restructured, because obviously if there's a bill that allows everybody to share in the private and public services, health services, it means that somebody must be able to pay for those services. And as we know, the government cannot afford to have more money. Unless, of course, like everybody else is suggesting in the industry, they're going to be adding more taxes. And that is what is the public outcry is about.
So it seems as though the government actually put a noose around its neck. You said that it's not included in the budget. The private sector seems not to be really in tune with this particular scheme. So if you're going to be very critical, some people have said that this is probably a political gimmick. Let's leave that a bit and look at how do you now think the government will be able to raise the finance for this particular initiative?
The good news is that you and I are not politicians, so we're not going to speculate where the money in the budget is going to come from. But hey, listen, you know, the interesting thing is the last 6 months, the government has been putting a number of regulations into place. There's something called the two-pot system that's going to change the retirement sector for a while. There's this national health bill that was signed by the president into law. So there's been it seems like they're saying that there's a push for certain legislations to be changed in the favor of the ruling party, because come next week, just 8 days away now, 29 May is going to be elections. And obviously these things are critical in this political environment that we're in. Secondly, where is the money going to come from? So if you look at the bill itself, it seems to suggest that there must be a share pool of funding that comes from both private and public sector. That is why the private sector is concerned. How is it that they're going to, already as expensive as healthcare services are in South Africa, going to add to more pain to their current subscribers to be able to incentivize the government to be able to provide those services?
Yes, Clive. Clive, sorry to come in here because we actually have limited time. Talking about the pool of funds and how it's going to dent the pockets of the citizens, we heard of payroll tax, personal income tax, and reallocation of current private medical aid spending and all. Now, of course, we understand that there's a possibility that there might be shortfalls in the funding, in these funding strategies, but then that is going to actually bite hard on the people affected. How do you think this is going to pan out?
It is very true. So, I mean, you can't say now people are going to have better health benefits, at the same time burden them with the cost of having that benefit in the first place. Secondly, South Africans are already not happy with the current taxation. You've just mentioned some of them. We have pay-as-you-earn tax. We have personal income tax. Now we're going to have this additional tax that's going to come on to us, and we have to pay. I don't want to waste your time and remind you about the e-tolls, which also was a failure of government implementation of things that they hadn't budgeted for. That's the concern from private sector. That's the concern from the industry. That's the concern from the Johannesburg Securities Exchanges. How is government going to balance the act of having a budget that is going to be equal for everyone? And apart from the fact that they'll have to definitely ask people to pay up a little bit more. So what is it that is a concern is, yes, you're giving a better service if it is going to be better. By the way, nobody knows. But you are also asking for people to pay a bit more. Which one is the better of two evils? Are you saying you want them to have good health at an expensive price? Or are you saying you're going to still have the same standard of service that you have currently, but now they have to even pay more for it, which might in itself, I'm sure some colleagues will agree with me, can create a little bit of distress.
Well, that's a bit of a challenge there for South African citizens, because we see that these taxes will actually rise up to about 80%. If that is to be finally ratified, it's going to be a big challenge, I tell you. Well, Clive Ramathibela-Smith, of course, it was nice doing this with you within the shortest possible of time that we have, but then we appreciate you for your time. Enjoy the rest of your day.